Joining us now from Albury Wodonga is Dr Craig Underhill. Craig, can you introduce yourself to our viewers?
I'm the Director of Cancer Services at Albury Wodonga Health, and also I'm a Clinical Director with the Hume Region Integrated Cancer Service, so that extends across northeastern Victoria and into New South Wales. So we're on Wiradjuri country here. You can see Lake Hume in the background. I put up, there's a photo of Bell Bridge. I got sick of the Golden Gate Bridge on the Zoom background. And I saw some data recently. I know you do some work with Jacinta Alston, and she gave a really impassioned call to action at a ministerial roundtable at Parliament House recently. She showed some data where because the peak of smoking cigarette use in the Indigenous population has only been recently, we'll see unfortunately an increase in incidence in lung cancer for another decade or two. In the in the European population, we went through a peak in smoking usage in the last 20 or 30 years, and as a consequence, the incidence of lung cancer has fallen. But unfortunately, mostly driven by cigarette abuse, we're going to see a rapid increase in cancers in the Aboriginal and Torres Strait Islander population. That's the expectation. So although it's a small population, there's a lot of work to do, and obviously there's an intersection with distance and access to treatment, social economic disparity, and so that all intersects and makes the we really all need to roll up our sleeves to address this issue. And I know that Cancer Australia and the Australian government has a focus on inequity and the problems in the Aboriginal and Torres Strait Islander population with cancer going forward in a new cancer plan that's being written.
And just to be, so I'm really clear, that ministerial roundtable, that was in Canberra, was it? So that was a national roundtable? That's
right. It was just recently, and so we were out of lockdown, and it was one of the first face-to-face meetings for many people. We met in the Great Hall in Parliament House. I think there was about 60 or 80 people with great consumer representation from the Aboriginal and Torres Strait Islander population, and a whole lot of cancer experts. I often get dragged out as one of the regional experts, and so it was great to be there and give some input in the very first framing of the National Cancer Plan, which will be a 2-year process, lots of consultation.
Okay, so action happening to close the gap.
We've done some cultural training with the workforce, and that's ongoing, so that's really important. A small example is that the Aboriginal flag is flying outside along with the Australian flag, and I heard Lyndon Burney talking on ABC Radio, one of the House of Representative members, who's Aboriginal woman, and she was saying that she goes to schools now and they all have the Aboriginal flag. So, I think in recent years, and they all do the welcome to country at the start of the day. So there's been, some small steps like that. We also did a piece of work in conjunction with Cancer Australia a number of years ago. One of our project officers led that, and it was called Yarning in Lung Cancer. And so it was to raise awareness of lung cancer and the issues of smoking and lung cancer in the Aboriginal and Torres Strait Islander population. That's available online on the Cancer Australia website. So that was some educational modules. So that was a really great piece of work, which was co-designed with the local population and the Albury Wodonga Aboriginal Health Service, who I think you've interviewed. In the next 2.5 years, in the Victorian Cancer Plan, there's a whole piece of work to implement what's called the optimal care pathway. So as you know, for every tumour, head and neck, lung, breast cancer, there's a framework for the best way to manage a patient, and there's a specific one for the Aboriginal and Torres Strait Islander population with cancer. So we'll be starting some work broadly in Victoria, including regional Victoria, over the next 2.5 years to start implementing that framework.
In a nutshell, is one key part of that it sets what should be the time frame for certain testing, access to treatment, further testing, follow-up. I'm a cancer survivor myself, and there was this whole path that you go on, and it's trying to set time targets so there isn't delay. Is that a critical part of it?
That's exactly right. And what support services should overlay that whole process to support the patient and their family. And
I see.
I would like to mention one other great program that we're involved with, Julie. We just received some funding from the Medical Research Future Fund for regional Victoria, a program called Revitalise, and an element, it's looking at some health services research that will answer regional specific issues. So we're looking at programs in teletrials, so running trials, clinical trials by telehealth, the geriatric oncology program, palliative care trials, supportive care trials. But there is also an element in Indigenous health. And so we've co-designed a program with the Victorian Aboriginal Controlled Health Organisation, and we'll be working within our region in Goulburn Valley to pilot some programs. And we're looking at barriers for Aboriginal and Torres Strait Islander people with cancer accessing clinical trials and looking to overcome the barriers to clinical trials. So we've taken that optimal care pathway and just taken the clinical trials part and doing some a deep dive and trying to resolve that issue and to get more people onto clinical trials.
Craig, I'm just so grateful to you for taking time from your patient work to join us for this webinar. Thank you so much.
Not at all, Julie. I mean, I think all of us in the cancer field see this as a really, really important issue that we need to tackle. And so I think everybody, has a desire to do that and to partner with the Aboriginal organisations to try and make some inroads.
Thank you.
Thanks, Julie.